And hello everyone, happy Monday. I'm Robin Haynes here with a special edition of Daytime featuring our friends at Licking Memorial Health Systems, which of course includes CEO and President Rob Montagnes.
It's been a long time. It's great to be back. We have a lot of important health issues we need to discuss today. I'm so happy to be here.
Yeah, it's a pleasure to have you guys back. And we're going to start with something that I am very familiar with because I am a 12-year breast cancer survivor, as just discussing. So we are going to talk about the prevalence of breast cancer here in the U.S. and really looking at what it takes to ensure the long-term success of those diagnosed with that and really all cancers.
Yeah, and then we're going to talk about dealing with addiction. It's a lifelong process. We know those numbers have gone up during the recent pandemic and how those struggling have options in Licking County.
And we round out the show with a push for more nurses as that need grows and 5 fast facts about LMHS. So keep it here for this all new Daytime. Right, relationships are really the key to healthcare success, and Licking Memorial Health Systems is highlighting the one that they rely on to help all those facing a cancer diagnosis.
Yeah, we're so proud to work with the Columbus Community Clinical Oncology Program, that's tough to say, but to offer our own comprehensive services in Licking Memorial, in Licking County is very important to us.
Absolutely. So I'm happy to have Dr. Deanna Mullins join us to discuss what it is that they have available. So Dr. Mullins, thanks for being here.
Thank you for having me.
Dr. Mullins, I love to brag about our oncology services, how you care for cancer patients in our community. So share some of the highlights of our programs, what we have to offer at Licking Memorial.
So we offer several different types of surgeries, general surgeons who perform multiple different cancer surgeries here at Licking. We also obviously provide medical oncology, which is my specialty, where we treat cancers with medicines, including chemotherapies, immunotherapies, hormonal manipulations, and things like that. We offer radiation therapy services locally for patients to cut down on travel. We have cancer support groups as well as cancer caregiver support groups. We also offer a chair yoga program for our patients. We have cancer rehabilitation services as well, including physical therapy, a lymphedema clinic, and a wellness center. So those are several of the different services that we offer locally for our patients.
And I will say I'm acutely aware, right, that breast cancer is the most common cancer among women. We talk about a lot, though, the amount of people that are affected by this. It was 1 in 8. I don't know if those numbers have changed, but I want to talk about when somebody comes into your clinic, Dr. Mullins, what are some of the services that you can provide for them specifically when we talk about breast cancer?
So one of the things that we talk with patients when they first hit our door is whether they qualify for genetic testing. And this is a service that we offer right there. We draw the blood work right there to help determine whether more significant surgery is necessary for them, as well as to protect their families, knowing what their genetic risk for cancer is. We're able to provide our any kind of chemotherapy services, medication services there in the hospital, as well as get you referred over to our surgeons should you need a surgeon as part of your treatment plan.
And one of the things that I just want to point out too, because you have a navigator, and the navigator to me was like this unfounded resource that I did not know existed before I was in this journey, but boy, what a help that is to these patients.
Yes. So Miranda Bailey is our new breast cancer navigator. She has been a game changer for our patients. When it comes to getting the report of an abnormal mammogram, that can be one of the scarier moments in a woman's life, and she is there from that moment to help the patient get to what the next step is when they're get their biopsy set up, get them to the medical oncologist or the surgeon, and really streamline that process and have a hand to hold and a number of familiar face and a number to call in a very anxious period of time for patients.
We've talked a lot about breast cancer, but we see a lot of other cancers up on the unit. So maybe discuss some of the other cancers and how we help facilitate their care.
Yes. So we also have a general patient navigator who helps out all of our newly diagnosed cancer patients. helps them to go over the treatment plans because these things can be complicated, and so it helps to hear it more than once or twice or 3 times. Helps to coordinate care because a lot of times for something like breast cancer, for instance, we're sending a patient to the surgeon, we're sending the patient to radiation oncology as well as us. So they help to bridge the gap between communication of the 3 teams as well.
I want to point out, because I saw this picture and you guys are really good about posting these for a cancer survivors picnic. You do this every year, and I think it's so cool that you get them together to celebrate, because that's what it is, right? It's very tough. You're at the beginning of your journey, you're sad, you're anxious, but celebration is going to come, right?
Absolutely.
No question. We get a lot of very motivated and motivational stories from our patients, and they help inspire other cancer patients within our community.
All right, a great time. Dr. Mullins, thank you so much for being here with us and for all of the things, of course, that you do for your patients at Licking Memorial Health Systems.
Thank you.
All right, well, another battle that too many people face these days is the one regarding addiction. So we're going to discuss the pandemic's impact on this issue and our overall mental wellness up next.
Then later, there's a big need for nurses. We're going to lay out our benefits and the rewards of taking care of patients in a community hospital setting like Licking Memorial.
And a quick note that today's show is sponsored in its entirety by Licking Memorial Health Systems. We'll be right back. Oh, when it comes to treating behavioral health disorders and addictions, right, the intensity of the treatment must match the severity of the disease. And that means that every plan really should be customized for every patient.
You know, clearly that is the goal at Shepherd Hill. We want our private residential treatment center, which is led by Dr. Andrew Heiberger, who's right next to me here, board certified in addiction medicine.
Yeah, Dr. Heiberger, great to have you here. And it's important to talk about, but we know the last couple of years have not been good for those who have been struggling with addiction. In fact, a lot of these numbers on the rise even. So talk to us about what you've seen. What is going on in the world of addiction right now?
Well, the pandemic obviously has had a huge impact on patients with substance use disorder. Probably somewhere on the order of 100,000 in the last 12 months have died directly as a result of overdose death. That's just overdose death. That doesn't count the 150 or so thousand people that died from alcohol use disorder and the 500,000 that die every year from tobacco use disorder. So it's a huge problem, and we're actually losing ground. In Licking County alone, in the first 4 months of the year, there were 25 overdose deaths. That's just Licking County. The same period last year, 14. So we've seen nearly double the number in our own county, and it's devastating. Isolation, the lockdowns have been particularly harmful to our patients because that sober support network, which is so critical for people in early sobriety, basically got shut down for almost 2 years.
Yeah.
Now, have you seen some resistance to seeking treatment, either because of anxiety about going out, coming to Shepherd Hill or other facilities for treatment? What are some of the other drivers for this increased diagnosis?
Well, there certainly is a lot of resistance, and the fact is that unfortunately most patients who have substance use disorders die from them. In fact, the mortality rate from a substance use disorder is actually higher than most cancers. Isn't that something?
Yeah.
And it's something that most people don't think about, but that stigma about having an addiction, about seeking treatment for an addiction, is one of the things that keeps people from getting the help that they need. If you don't believe that you have a real disease, that you just have weak moral character or ignorance, then why bother going to a hospital to get help? Of course, nothing could be further from the truth. These folks are suffering from a biochemical and biological disorder that responds very well to treatment.
And they have to go get it, which we were just discussing, Dr. Heiberger, the stigma, you know, over the course of maybe the last decade. Let's start there. It has been about breaking down these stigmas so that people do go in and get treatment. Have we seen progress? Once people get in the door, are they actually understanding that this isn't their fault? This isn't something that they need to take blame for and feel that shame about?
Well, in our treatment center, one of the biggest things that we focus on is education about the disease, what we call the modern disease model of addiction, which explains how abnormalities inside the brain that are very well delineated and very well understood are the cause of the abnormal behavior. These people are not weak-willed, stupid, and bad. They have a disease that causes them to do those behaviors, okay? And that disease drives them to act the way that they do. Now a lot of people say, well, that's just an excuse, they're just bad people, blah, blah, blah. Why don't they just put it down? But that's nonsense. And that attitude, that stigma kills people.
You know, Dr. Heiberger, I think a lot of folks maybe don't appreciate how immersive the treatment is and the length of time it often takes, that it's not necessarily some prescriptive number of days or weeks that each individual may have to go through treatment. So maybe talk about those two factors, the immersive nature and the time.
Right. So at Shepherd Hill, we have all levels of care. We have inpatient detoxification. We have treatment at, I guess you'd call it residential. We call it partial hospitalization with overnight stay. And then at the outpatient level as well. And what we do, particularly in our partial hospitalization program, is people are working towards recovery from about 7:30 in the morning till 10 o'clock at night every day. And they're in an environment with other people also seeking to get better from addiction. And it's a very healthy, rewarding environment for folks that are willing to come in and get started with treatment. And I'm very fortunate to be involved with this organization because we've got a number of really fantastic people. We have people who have spent their entire lives working at helping folks with addiction, and that really makes my job a whole heck of a lot easier.
And Dr. Heiberger, it doesn't end when they leave the facility as well. We talk about being immersive. I mean, it goes beyond your doors, right?
That's correct. We try to maintain contact with the patients as long as we can. We provide an aftercare service. It's an hour a week for a year at least afterwards. Some of our patients stay on even longer than that. And of course, we continue to encourage that very active engagement in 12-step recovery programs, because ultimately that's where the answer is. That for our patients is where they deal with the little ups and downs of daily living and how they can learn to live and not make that choice to pick up and start using again. Because what we're seeing nowadays is people out for a while, a little bit of time, 6 months, a year, sobriety, picking up and using one time, and that leading to a fatal overdose. Yeah. Because of the potency of the drugs that are out there on the street nowadays, that's what's happening, and that's killing our children.
Oh, you can see your passion is clear for helping people get through this, so we appreciate you being here and sharing with us.
Thank you.
Thank you.
Well, up next, are you looking for a job that guarantees no 2 workdays are alike, where you'll be challenged and find fulfillment in equal measure? Look no further than the nursing teams at Licking Memorial. And another note, today's show is sponsored in its entirety by Licking Memorial Health Systems. A career in nursing will undoubtedly be one of the most challenging yet rewarding experiences of your life.
And you know, Robin, I think with Licking Memorial, we offer a unique setting where the nurses really get to know their patients on a personal level and really get to see their hard work pay off.
And we have the person responsible for recruiting these caring individuals with us. I'm so happy to have Heather Burkhart joining us today. So thanks for coming on.
Thank you for having me.
All right, Rob and I know we've talked many times, right, about all of the equipment that you guys have, just the state-of-the-art technology that you utilize. So shed some light on how that helps your nursing staff, because people coming in want to know that they have these tools at their disposal,
yeah,
right?
Absolutely. So when we look at implementing new technology at the hospital, from a nursing perspective, we're looking at 2 things. Is it going to be able to provide safe quality care to our patients, and is it going to fit efficiently into the nursing workflows that already exist? Some of that technology, just as an example, we have our Hillrom Centrella smart beds that we just implemented housewide at the beginning of the year. It provides contact-free continuous monitoring of a patient's heart rate and respiratory rate 24/7. It will alert the nurses if there's a decline in patient status so that they can react very timely and do assessments, provide interventions, hopefully being proactive in our care so that we can stop a patient from progressing to a code blue type situation. Also with our beds, the nursing staff love this technology. It's our Hercules mattress system. So with the push of one button, they're able to move a patient up in bed. Back before we had Hercules, they'd have to go gather a couple other employees. We'd manually be pulling patients up in bed, so it saves them a lot of time. And from a patient care perspective, we have less skin breakdown because we're not shearing against skin with our sheets that we were using once upon a time. So great technology. We also have our Lucas device that we use in our ED and throughout the house. That's when we are running code blues and we have to do CPR. That device actually provides those chest compressions. It's great because it frees up a nursing employee to do other tasks during a code blue, but also provides standardized compressions, which is vital for patient outcomes as well. in OB, we do a lot of work to keep our infants safe and secure. So I feel like we've taken it one further step to give them extra security throughout their lifetime by using our Certiscan technology. We're able to gather a digital footprint of the infant, which has become the gold standard for infant identification. We actually pair that with mom's fingerprint, so they're connected in a nationwide database. So if that child, God forbid, were to go missing in the hospital or beyond in their lifetime, we can use that to identify them down the road. And then the last piece of technology I'll talk about that really helps nursing is our Da Vinci robot. We have implemented that in our OR. We did that last year. Robotic surgery has great clinical outcomes. We reduce infection rates, less blood loss, better pain control after surgery. So it definitely impacts the nursing care that we're giving both in the OR and post-operatively too.
So you've heard Heather talk about all the technology we have.
Yeah.
It's important that we keep our nurses up to speed, new procedures, new technologies, and we've invested quite a bit in an education training environment for them. So maybe talk about that.
Yeah, absolutely. So we have a dedicated clinical training center for clinical staff specifically, so our nurses and our POCTs. We've got lecture rooms, a computer lab, skill stations with different pieces of equipment that we typically use at the hospital, so they're familiar with it. And what I'm most proud of are our 2 sim labs that are equipped with high fidelity simulation mannequins. They can go and practice their skills on those mannequins. We have clinical coordinators that are educators. They're really tasked with rolling out that education. We do that through shift huddles and staff meetings. We have annual skills days as well that they check people off on competencies on every year, so they're a critical piece to that. We also leverage CE Direct, which is an online tool that we can leverage for free contact hours, continuing education hours that nurses are required to have every 2 years. So that's free to our staff if they choose to take advantage of that. We have great established relationships with our local nursing programs, so they get tuition at a reduced rate if there are employees looking to get their RN or their BSN, and we have great tuition reimbursement as well. And then our newest program that I'm most proud of is our nurse residency program that we just started here this past year. That program, we use that to support nurses that have less than a year experience when we hire them in, and they're in that program for the first year of employment. So it really provides them with a support system for that first year as they're transitioning from a student to a new nurse. We have didactic lectures, they have hands-on skills competencies, they have sim lab experience, and a guided roundtable discussion, which is great because they can learn from each other and what those real life experiences have been at the bedside.
That's a lot. I feel like you provide them with everything they possibly could need. So then let's talk to the people out there, Heather. Let's say, hey, what kind of, ideal person are you looking for to join your nursing team?
Yeah, so we have several openings, like most hospitals really across the nation at this point. One thing I think that we're probably really, really proud of is that we have not had to use travel nurses. A lot of hospitals have had to staff upwards of 50% of their nursing staff with travelers. So if you come and work at Licking, you're working beside nurses that you know, and physicians that you know, because we're able to leverage our own staff to staff the hospital, which has been excellent. As far as other benefits that we have great health benefits. We have a 403B with a 4% match. We have generous PTO accrual. We do self-scheduling, so it helps them find that work-life balance if they're able to schedule themselves on the schedule. We have nurse tier pay, so based on experience and job responsibilities, you earn points and you can move up in the pay range quicker if you're doing more within the health system. We have an on-site inlays uniform store, which the staff love. We do annual uniform allotments, so uniforms are free unless they want to buy additional pieces to their uniform, which that's a great benefit to nursing staff.
Add the Mickey Mouse outfit like Rob always loves with the tie,
Yes,
you can have scrubs.
I don't know that we have Disney yet, but we may get there someday. So.
May get there someday. So there is a lot. I want to thank you so much, Heather. There are many benefits, obviously, for working for Licking Memorial Health System, so we appreciate that.
Thank you.
All right, after the break, we are going to wrap things up with our Fast Facts segment as Rob gets to expand on a few of these innovative ways that they are helping residents of Licking County. And again, today's show is sponsored by Licking Memorial Health Systems. Well, as we do at the end of all of our shows with Licking Memorial, we dig a little deeper into today's topics. This is our Fast Facts segment with CEO and President Rob Montagnes on the hot seat. Well, I wouldn't call it the hot seat because this is your chance to really shed light on what you do, and there's so much going on at Licking Memorial, Rob.
I'm always happy to highlight the great things that our employees and staff are doing at Licking Memorial, so let's get at it.
Kick it off. Okay, so first up, we talked, of course, about all the oncology services. So the support for cancer patients, what do you want to expand on here, Rob?
I think highlighting the importance and availability of the navigators to help facilitate everything from billing to treatment to aftercare is so valuable for not only the patient but their entire support team and family.
Absolutely. Okay, the other thing, Shepherd Hill, we talked about addiction services, but they offer more than that. And a couple of things that we didn't talk about, I know I loved that they have yoga, right?
Whether it's helping with the mental health side of
Yeah.
recovery for many who have addiction and psychiatric issues that we need to deal with, including the family in something called Ask a Doc, so that the family can get answers to issues or concerns they may have about their individual or the disease or the environment when they come home. So a lot of support for the patient, but the extended family as well.
And the Ask a Doc, that is a free service to everybody, right?
Absolutely. Time when you have an opportunity, not online through a email question, but an opportunity face-to-face to ask and get answers from a physician.
Okay, next up, expand on your educational partnerships a bit.
Well, I think the education we have internally, Heather highlighted, but she also mentioned locally Central Ohio Technical College. I have to admit I am the chair of the board for that, and our OSU Newark campus offer a lot of great opportunities for local students who want to go into the healthcare field and ultimately work at Licking Memorial Health Systems.
You even had a bunch of seniors in high school I think not too long ago, right?
Sure, we do Camp Med, which is juniors going into their senior year to try and educate them about the various fields in healthcare and once again promote Licking Memorial.
All right, next up, you hope to engage, I'm sure, with kind of the next generation of employees. We talk about the nursing program as one of those, but you have something called the Nurse Practice Council. What is this, Rob?
We try and elicit information, suggestions, thoughts from our employees on a regular basis. And I think that council is a great example of an opportunity for them to get together, give feedback to management, administration, and then we can take their comments and try and put those into practice to either keep our patients safer, improve quality, or make their work environment better.
And Rob, I want to talk just quickly before we go to a community hospital. What are some of the benefits for people out there, both to the care side and for the employment side to working at a place like Licking?
I think a community hospital offers an opportunity to really see the impact you're having both on individual patients and the greater community. Whether I'm going to a ball game, the grocery store, to church, I get feedback on a regular basis. Whether that's positive or negative, I'm always happy to receive it and try and make our community hospital even better.
Absolutely. You do a great job at that. So, of course, I want to thank you, Rob, and the entire team at Licking Memorial Health Systems for sharing all the good work that you guys are doing for the community and for us today, and for sponsoring this episode of Daytime. You can learn more about all the services and what we talked about at lmhealth.org. So, Rob, you have this incredible team to be proud of course, and they have a wonderful advocate and leader in you. So, any final thanks you want to say to everybody today?
Thank you for having me back. I look forward to being in person in the future. I want to thank all of our staff who really battled over these last several years that I haven't been in person. Tremendous work by all of the staff at Licking Memorial. Thank you for your work.
Absolutely. All right. Thank you again. Of course, that is our show for today. Be thankful for today, as always, and I will see you tomorrow.